Maricopa County reports first West Nile virus death of the season. How to protect yourself. A single life lost. That's the harsh wake-up call Maricopa County received as it confirms its first death of the season tied to West Nile virus. The victim, an elderly individual coping with other health problems, serves as a deeply personal reminder of just how dangerous this disease can be. But here's where things get especially important, and maybe even controversial. Can enough truly be done to protect our vulnerable populations from a threat that arrives like clockwork each year? Dr. Nick Staub, Chief Medical Officer for the Maricopa County Department of Public Health, MCDPH, expressed his condolences, emphasizing the seriousness of the West Nile threat. This loss should urge everyone to recognize the real risk West Nile virus poses, especially to seniors and people with existing medical conditions, he said. Dr. Staub also pointed out, the monsoon season is a double-edged sword. While the rain is a blessing, it creates the perfect breeding grounds for mosquitoes. That's what makes prevention and awareness so vital. Residents need to use insect repellents, eliminate any standing water around their homes, and stay indoors during times when mosquitoes are most active. To date, Maricopa County has already seen 17 confirmed cases of West Nile virus in humans this year. Experts note that in Arizona, mosquito-borne viruses like West Nile are most prevalent from May through October, coinciding with heightened mosquito activity. This timing is no accident. Warmer months paired with increased rainfall create an environment where mosquitoes, and, by extension, the viruses they may carry, thrive. How does West Nile virus typically spread? It's most commonly transmitted through the bite of a mosquito that is carrying the virus. And this is the part most people miss. Most individuals infected with West Nile virus will have no symptoms at all. However, about 1 in 5 might come down with fever, headaches, and muscle aches, a flu-like illness that can be unpleasant but is usually mild. The real danger lurks for the few, roughly 1 in 150, who develop severe complications. In these rare instances, the virus can attack the brain and nervous system, resulting in conditions like encephalitis or meningitis, both of which may cause paralysis, lifelong disabilities, or prove fatal. Unsurprisingly, those at greatest risk include the elderly, people with weakened immune systems, and anyone dealing with significant underlying health issues. The Maricopa County Department of Public Health works in tandem with local healthcare professionals, the Maricopa County Environmental Services Department, MCEST, and partners at the state and national levels to monitor for West Nile virus outbreaks in both people and mosquitoes. This multi-agency approach extends to a robust year-round mosquito monitoring and control program led by MCEST. So, what can residents actually do? Officials urge everyone, whether you've lived here for decades or are just visiting, to take practical steps to fight the bite. Here are some simple but effective ways to reduce your risk. Protect yourself from mosquito bites at all hours. Mosquitoes can be active day or night. Use EPA-approved insect repellents, like those with DEET or picaridin, on exposed skin and clothing, always following the instructions on the label. Remove and drain any sources of standing water outside your home. Items like buckets, plant trays, pet dishes, toys, plastic sheeting, and even old tires. These all become potential breeding spots for mosquitoes after rain. Don't forget to scrub the sides of plant saucers and similar containers, where mosquito eggs might cling. Keep windows and doors tightly screened, and repair any holes to prevent mosquitoes from sneaking indoors. When the weather is forgiving, choose light, long-sleeved clothing to cover up. Pools and decorative ponds? Keeping them well-maintained prevents them from turning into mosquito breeding grounds. Want to dig deeper or check updates on mosquito-borne illnesses in Maricopa County? Visit maricopa.gov/fightthebite or check out the Spanish-language resource at maricopa.gov/nosdjepicar. Let's turn this over to you. Do you think enough is being done to limit mosquito populations and prevent diseases like West Nile, or are there steps still being overlooked? Should the county invest more in public awareness, or is personal responsibility the more important factor? Share your perspective in the comments. Let's hear your take on this ongoing public health challenge. Protect yourself from West Nile virus in Arizona. West Nile virus in Arizona, the most effective EPA-approved mosquito repellents for 2025. The threat of West Nile virus is more real than ever in Arizona, and protecting yourself from mosquito bites is absolutely critical. But here's where it gets controversial. Many people underestimate how important it is to choose the right mosquito repellent. Health experts consistently recommend relying on the EPA's list of approved repellents as your best line of defense against the mosquitoes that carry this dangerous virus. This season, Maricopa County has already reported 17 confirmed cases of West Nile virus, including the heartbreaking news of one fatality. These figures serve as a powerful wake-up call, especially as the monsoon season intensifies, creating ideal breeding grounds for mosquitoes. Source: https://www.abc15.com/news/health/Maricopa-County-officials-confirm-first-west-Nile-death-of-the-year. So, what should you look for when picking a mosquito repellent? The EPA-approved active ingredients to watch for on product labels include DEET, 10 to 30%, widely regarded as the gold standard. DEET offers long-lasting protection and is safe for children older than 2 months. Picaridin, this option is odorless, gentle on the skin, and effective not only against mosquitoes but also ticks. Oil of lemon eucalyptus, a natural, plant-based alternative, though it's important to note it's not recommended for children under 3 years old. IR3535, known for its long-lasting effects, this ingredient is often found in products designed for athletes or those with sensitive skin. Remember, no matter which repellent you choose, always follow the instructions carefully. Reapply as directed, especially after swimming or heavy sweating, to maintain effective protection. Looking back, 2021 was a devastating year for Arizona, marking the worst West Nile virus outbreak in U.S. history. Maricopa County alone recorded 1,487 cases and 101 deaths. While this year's numbers are thankfully much lower, the combination of high temperatures, stagnant water, and increasing humidity still creates a perfect storm for mosquito populations to flourish. And this is the part most people miss: staying informed and proactive is key. For up-to-the-minute updates on West Nile virus activity and expert prevention advice, check out Maricopa County's vector control dashboard here, https://www.maricopa.gov/632/vector-control. What do you think? Are you confident in the repellents you're using, or do you believe natural remedies might be just as effective? Share your thoughts and experiences in the comments below. Let's get the conversation started. Copyright 2025 Scripps Media Incorporated. All rights reserved. This content may not be published, broadcast, rewritten, or redistributed. Don't miss out on the latest health news. Sign up for the Headlines newsletter to stay informed. West Nile virus death in Maricopa County, how to protect yourself. ****, a silent, buzzing threat in our own backyards has tragically claimed its first life of the season in Maricopa County. Officials from the Maricopa County Department of Public Health delivered the somber news on Monday, confirming that a resident has passed away from complications related to the West Nile virus. This marks the first fatality of the year attributed to the mosquito-borne illness, which has already resulted in 17 documented human cases within the county. According to Dr. Nick Staub, the chief medical officer for the department, the individual who passed away was an older adult who also had other underlying health issues. This unfortunate event underscores a critical reality of the virus. This tragic loss is a stark reminder that West Nile virus can be incredibly serious, particularly for our older residents and anyone managing existing health conditions, Dr. Staub explained in a public announcement. He emphasized that while the virus can affect anyone, its impact is not felt equally across the population. And this is the part most people miss: for the vast majority of individuals, a West Nile infection goes completely unnoticed. In fact, experts estimate that roughly 4 out of every 5 people who contract the virus will never show a single symptom. For the 1 in 5 who do feel sick, the experience is often similar to a mild flu, with symptoms like fever, headaches, body aches, and muscle weakness. But here's where it gets truly serious. In a small fraction of cases, about 1 out of every 150 infections, the virus can invade the nervous system, leading to severe and potentially life-threatening conditions like encephalitis, inflammation of the brain, or meningitis, inflammation of the membrane surrounding the brain and spinal cord. When this happens, the symptoms become far more alarming, including intense headaches, a stiff neck, disorientation, vision loss, and even paralysis. Dr. Staub issued a pointed warning to the community, noting that the risk is currently elevated. The monsoon season brings us much-needed rain, but it also creates the perfect breeding ground for mosquitoes, he stated. This is why it's absolutely crucial for all residents to remain vigilant. So, how can you and your family stay safe? The risk of developing a severe illness from West Nile is highest for individuals over the age of 60, those with compromised immune systems, and people with Crohn.